30 years have passed since AIDS was first identified. The deadly disease stirred fear and spread stigma throughout the world. 3 decades later, more and more people have access to treatments, infections are declining, and greater numbers of pregnant women living with HIV are keeping their babies free of infection, said Asha Rose Migiro, the UN Deputy Secretary General, during a press conference held on Friday at UN headquarters to launch the UNAIDS AIDS at 30 Progress of Nations report.
But of critical importance will be inclusion. We have talked about not continuing to treat HIV and AIDS in isolation. We have to see it in the totality of the health, socioeconomic agenda that we have. We have to include the youth who are the leaders of today. We have heard what Christina has said. That will be important. So we expect to have concrete steps where by 2015, by 2020, we are in a world where HIV and AIDS is not stigmatized, but we have reduced new infections, we have reduced discrimination, we have eliminated discrimination, and we have eliminated AIDS-related deaths.
The report, entitled AIDS at 30 Nations at the Crossroads, reveals that a record number of HIV-infected people have access to treatment, and that rates of new infections have fallen to below 25%. The report also shows that about 6.6 million people were receiving antiretroviral therapy in low and middle income countries at the end of 2010. India witnessed a 50% decrease in new infections in the last 10 years, and South Africa witnessed a 25% drop.
We are in the crossroad today. It's impossible for us to make sure that we'll go to scale if we don't have this South-South cooperation. This horizontal cooperation is critical, and if we want really to make sure that we democratize the problem solving by bringing a new innovation which can be helping people in the grassroots level to really manage and hone their response, we need to learn from emerging nation. You know, we would have never have people on treatment like we are having today without India. Almost 86% of the drugs which are made available to poor people today are made available because Indians were producing generics. We need to learn from that. We will not be successful without a new partnership built with also emerging nations.
Friday's launch comes in advance of next week's 3-day high-level event at UN headquarters designed to strengthen global efforts and partnerships to help eradicate the epidemic. The Undersecretary General said next week's high-level meeting is our chance to chart a new bold path, stating that the target is clear: the next 000. 0 new infections, 0 discrimination, and 0 AIDS-related deaths. More than 30 heads of state and government are expected to be here at the UN next week for the high-level meeting on AIDS, where a declaration is expected to be adopted that will solidify gains made and shape the future of AIDS by 2015 and beyond. Afaf Kanja for South News, United Nations.